Absolutely. And this is one of the most exciting benefits that we're seeing with GLP-1s beyond just weight loss. Many studies have shown that GLP-1s can significantly improve obstructive sleep apnea, even in people who haven't reached or achieved their full weight loss goals yet. This improvement happens through a couple of different mechanisms. One is certainly that reducing your weight decreases fat deposits in your upper airway and neck, which can then lead to decreased inflammation and airway issues and ultimately allow you to breathe better when you're sleeping. Many of our patients report that they sleep better and feel significantly more rested within a few months of starting a GLP-1, and it's all related to this pathway. That said, the degree of improvement varies. Some people will see complete resolution of their sleep apnea. They don't have it at all anymore. Others see partial improvement. I always echo to people that it's important, if you're currently using a CPAP to treat your sleep apnea, it's important to keep using it while we monitor your progress and make sure that your sleep specialist is aware and can reassess to see if the CPAP can come off. Which is the next question. If I take a GLP-1, can I get off the CPAP machine? My answer would be, I love the optimism, and it's definitely possible for many, many patients on a GLP-1. That said, you have to see significant improvement in your sleep before I would ever recommend coming off of CPAP therapy. Whether you can stop CPAP at all depends on several factors. One is the severity of the sleep apnea to begin with. Two is how much weight you lose. Three is how much of your sleep apnea was related to weight versus other issues. Sometimes sleep apnea is really due to an issue in the brain rather than weight or fat deposits in the throat. And then four is your individual response to treatment. My recommendation would be, as you progress with weight loss, typically after losing about 10 to 15% of your body weight, you should undergo another sleep study to determine whether you still have sleep apnea and at what severity. If your numbers have improved significantly, at that point, it would be time to think about coming off the CPAP. Can I take a GLP-1 to help prevent type 2 diabetes? Absolutely. This is one of the most evidence-based benefits of a GLP-1 medication. Large clinical trials have shown that GLP-1s reduce the risk of developing type 2 diabetes by 60 to 70% in patients who already have prediabetes. Remember that these medications work by making you more sensitive to insulin, which helps your pancreas function more efficiently and reduces metabolic stress that leads to diabetes. Even beyond the weight loss benefits, GLP-1s have direct protective effects on your pancreatic beta cells, the cells that produce insulin, and therefore help to prevent you ever developing type 2 diabetes. If you have risk factors like prediabetes, a family history of diabetes, PCOS, metabolic syndrome, etc., GLP-1 therapy can be a powerful preventative tool. We're not just talking about treating the number on the scale anymore. This is where we really are fundamentally changing your metabolic trajectory and health